So with COVID-19 spreading, officials are desperate for ways to limit the risk and federal dollars available to help. In fact, a Charlotte company that sells air purification technology has attracted millions of dollars in business from local schools and governments. But some experts told our Nate Morabito that that technology needs more research to prove that it's safe and effective. In our latest Where's the Money report.
Research commissioned by Global Plasma Solutions shows GPS's products are effective, but some air quality experts say that's not enough to convince them. Whether you're hopping on a flight or making a pit stop at the NASCAR Hall of Fame,
we're doing all that we can to make sure we're creating a safe environment.
Checking out the checkers, or sending a child off to one of more than 50 area schools.
What I have in my hand is an example of the device that we will be installing.
Local government's investment in the promise of improved air quality and protection against the spread of COVID-19 runs through every city-operated building in Charlotte and at least 3 school districts.
It's working hard to clean the air, even though you're not aware that it's around you.
Charlotte-based Global Plasma Solutions touts its needlepoint bipolar ionization technology as another level of pandemic protection.
A layer of safety.
GPS says the devices, installed in existing HVAC systems, release low-energy ions into the air that attract particles, making them larger and easier to filter out, deactivating pathogens at the same time. Tests by a third-party lab hired by the company concluded the technology reduced SARS-CoV-2 by 98% over the course of an hour inside a sealed chamber. But a disclaimer notes GPS's products are not intended to take the place of reasonable precautions to prevent the transmission of disease. All that said, some air quality experts from across the country,
a lot of them don't seem to do much,
including North Carolina, are not convinced this kind of technology is worth it.
The net benefit is unclear. Let's put it that way.
Glenn Morrison is an environmental science and engineering professor at the University of North Carolina at Chapel Hill.
I really don't like the idea of putting a bunch of ions in the building.
He says he's worried about the unknown health impacts of changing a room's chemistry.
There's not enough information out there about what is the impact of operating these devices on air quality in total, and also on lung function and things like that.
He and others say there are plenty of proven filtration options already out there.
Start with thinking about traditional technologies. New technologies are not proven.
Government agencies are not alone in looking into alternative technology. Businesses have done the same. A Charlotte hospital system and local brewery install GPS products.
If it's a pathogen, they make it so it can no longer infect somebody.
Executives celebrated the technology in interviews with WCNC Charlotte before debate in the scientific community began, but recently declined to answer questions on camera.
My message is pretty clear. Don't use these devices.
This as experts like Bud Offerman continue to speak out about this kind of technology.
Just all of these additive devices was my message.
GPS is suing Offerman's San Francisco company for defamation after the environmental engineer warned last year one should not expect the devices to have a significant effect on airborne concentrations. Offerman is serving as a paid expert in a lawsuit filed against GPS.
I stand by what I wrote.
Then there's Colorado State University assistant chemistry professor Delphine Farmer, a co-author of this peer-reviewed study GPS calls faulty and inconsistent.
As far as we know, these devices have been shown in real-world environments to do very little.
She told us ongoing research awaiting publication continues to validate the need for more research.
We can't really trust this paper, but it is informing their opinions.
Dr. Lyle Burgoon shared his critique of Farmer's research.
It's demonstrably false and it's extremely misleading.
The toxicologist and former U.S. Army and EPA employee from North Carolina is an expert on safety, hired by GPS. He also works with Michigan State.
Based on my research, in my expert opinion, I have not seen any evidence that there are safety issues or concerns.
The parent says schools are already full of volatile organic compounds, and these devices don't raise any red flags when it comes to safety.
I would have no concerns with this technology being installed in their schools. I would actually welcome it.
Even so, he agrees there's no harm in additional research. GPS says few, if any, air cleaning companies have invested more in research, development, and testing to ensure the safety and efficacy of its technology. In a statement telling us in part, Over a decade of rigorous scientific testing and real-world results show that GPS technology is safe and effective and brings an added layer of protection to multi-layered building-wide air filtration systems, adding concerns about the effectiveness and safety of our unique approach to ionization are unfounded and inconsistent with the data and information from extensive research and testing on GPS products and positive customer results from 250,000 installations around the world. As the first round of installations wraps up at 36 Charlotte-Mecklenburg schools, outside questions are not slowing down the district. Pending board approval, CMS is moving forward with Phase 2, which includes installing the devices in gyms, cafeterias, and auditoriums at those same schools. Nate Morabito, WCNC Charlotte.
Hey, if you're asking where's the money, we're here for you. Just go to WCNC.com/money and you will find links to our stories and helpful resources.